Hello everybody, so glad to have you along today for Spotlight Carolina. I'm Mark Cady. When it comes to cancer treatment, Messino Cancer Centers have been a leading provider in cancer treatment in our region for more than 30 years, and today we're excited to be joined by Dr. Martin Palmeri from Messino Cancer Centers. Thanks so much for being with us today.
Hey, thank you very much for having me on the show.
I want to talk a little bit about this pressure that, providers, healthcare providers are under. High quality care, but you're forced to reduce costs. How does Messino Cancer Centers do this?
So Messino Cancer Centers, our philosophy is always that patients come first. And the way that we do this is we do this through personalized care plans, evidence-based treatment, but also making sure that our patients have access to our providers 24 hours a day. To help us do this in a cost-effective manner, we implement something called the Oncology Care Model. And this was something that was designed by Medicare a couple of years ago to ensure that patients get high quality, cost-effective care.
How does the Oncology Care Model program work?
So the Oncology Care Model has several facets to it, but one of the key features of it is that we want to make sure that our patients have access to an oncology specialized nurse 24 hours a day. In addition to an oncology specialized nurse, we also have a care manager that helps our patients go through this process of their diagnosis, cancer treatment, and then recovery. So we can almost think of them like cancer coaches. For many of our patients, they could have complications from their treatments, 1 in the morning, 2 in the morning, 3 in the morning, and having someone that they could call in the middle of the night to answer their questions and triage their care could help save our patients a trip to the emergency room or an unnecessary hospitalization.
Talk to us a little bit about the cancer community treatment, when you're treating people as a community versus the individual hospital-based treatment. How is that better for the patient? How does that help them?
Okay, so one of the things that we find is that community-based cancer care is markedly cheaper than hospital-based cancer care. There was a study in 2016 by Milliman which basically showed that community-based cancer practices are on average 34 to 42% cheaper than compared to the exact same services provided in a hospital environment.
Talk about bills and deductibles and insurance claims. All these things can be really overwhelming, especially when people are trying to get healthy. How does Messino Cancer Centers help?
And one of the biggest issues that we're seeing right now is surprise billing, unexpected charges, and just a variety of things that for a patient who's struggling with their cancer, they just have these surprises that come at them. So one of the ways that we try to address that is we have a financial counseling team that work with our patients from the get-go to make sure that their costs and expenses are clear and they know exactly what they're getting into.
MessinoCancerCenters.com, the website to learn more information. You can call 833-758-0023 or 828-212-7021.